Today we will be discussing athletes' experiences of psychosocial risk factors preceding injury as studied by Urban Johnson,
Psychosocial is defined as social conditions that relate to and adjust to one's mental health. They can be both unconscious and conscious.
which means the way we act in social situations with our friends, teammates, family, and coaches. Anytime we socialize with others, this can be affected by our mental health.
This study involved interviewing 20 competitive athletes with a mean age of 22.7 years in order to learn about popular psychosocial risk factors and how they influenced acute injury. After conducting the interviews, there were four main risk factors which played a key role in preceding injury in sport. The four factors that emerged were history of stressors, persons factors, fatigue, and ineffective coping mechanisms.
History of stressors. Past triggers that have preceded injury. These stressors were broken down into two subcategories: stress inside sport and stress outside sport. Stress inside sport. Demanding situations that occur in sport and physical activity. This includes changing sports context, when the environment of your team setting changes, such as your practice space is changed or teammates who have stopped participating, and previous sport injury record. A previous injury may act as a stressor and lead to new injuries.
Stress outside of sport. This involves stressful living conditions outside of sport and physical activity. Things like turbulent everyday life, like obligations, demands, and responsibilities applying for university, or work-related stress, stressors directly oriented to working situations, like feeling of hopelessness and resignation.
Person factors. Stressors that occurred on an individual level, often tied to personality. The two main subcategories that emerged were worrying about performance and vacillating effort.
Worrying about performance, also described as any issue regarding achievement in the sports setting. This is broken down into performance anxiety, which are situational factors during performance like the importance of a game and the type of role you play. Also, concentration disruptions, which are periods of unfocused and neglect for routine. Facilitating effort, stressors directly tied to a person's vulnerability to receive an injury. As well, lack of motivation, which is any absence of reasoning to continue the sport.
Fatigue. Athletes involved in rigorous, time consuming training to enhance performance require both mental and physical rest. It is divided into three subcategories: psychophysiological fatigue, being tired and drained of energy, and insensitivity to body signals.
Psychophysiological fatigue occurs when athletes feel 1. Exhausted, and 2. Far from being physically ready for physical activity. Being tired and drained of energy are both initial warning signs for injury, and they may lead to somatic or physical problems.
Insensitivity to body signals, ignoring one's own body, and lack of proper care for oneself.
Finally, we have ineffective coping mechanisms, which is an athlete's ability to deal with demanding situations and events. This is broken down into negative influence from others and oneself, criticism from coaches, leaders, and clubmates, self-generated criticism, and finally, lack of social support.
Negative influence from others and oneself, an ineffective way of dealing with criticism, individually and from others. Criticism from coaches, leaders, and clubmates. Pressure placed on athletes from authority figures or others involved, such as teammates. Lack of social support. Lack of a connection amongst teammates and friends.
Finally, there are many recommendations that were made after the data was collected. Each individual psychosocial risk factor affects an athlete in a different way and to varying degrees. Both coaches and athletes should be aware of the psychosocial risk factors presented in order to reduce the chances of acute injury in sport.